Are you considering getting dental implants, but the price is holding you back? What if I told you you could save up to 70% on the cost of your procedure just a short flight away in Costa Rica? Hello, my name is Wes Jacobs. I'm the founder of Apollo Medical Travel, and in this video I'll be sharing with you the lessons I've learned helping dozens of people get full mouth restorations right here in San Jose, Costa Rica. I'll be going over the procedures themselves, prices, the logistics of a trip, and how to prevent and address certain problems that may arise. A dental implant is a three-part system that replaces a missing tooth. The dental implant consists of a titanium screw that attaches into the jawbone, an abutment, which is a connector, and a crown. A complete dental implant typically costs $4,000 to $5,000 in the US and $1,200 to $1,600 in Costa Rica. Dental implants are the gold standard for replacing missing or damaged teeth because not only do they help you apply more pressure when you bite, enabling you to eat all of the foods you enjoy, speak clearly without interference, and smile confidently with a natural appearance, they also minimize the loss of jawbone that happens when you lose your natural teeth. You see, the roots of your teeth stimulate the jawbone and prevent it from deteriorating in a process called resorption. It's easy to identify someone who is a long-time denture wearer because the jawbone resorbs and they get a shrunken appearance. Dental implants can also support something called a bridge. Bridges are priced based on the number of implants, abutments, and crowns used in the system. In any case, they're going to save you money because they minimize the number of dental implants necessary by allowing you to support more than one crown per implant. Taking this concept one step farther, all-on dental implants replace a full arch of missing or damaged teeth with a system typically consisting of 4 or more dental implants. Typically, 4 or 5 dental implants can support a 12-tooth bridge, while an all-on 6 or more can support a 14-unit bridge. For reference, a perfect arch of teeth has 16 teeth, including 2 wisdom teeth, which most people have removed, and a 14-unit bridge is about as good as it gets. In order to place dental implants, your dentist will need to take a 3D X-ray called a CT scan. This scan allows your dentist to see the quality and quantity of bone in your jaw and plan your surgery. In some cases, patients may have experienced some bone loss, and it may be necessary to do a bone graft or a sinus lift. In a bone graft procedure, bone material is added to the jawbone. Once the material is added, the patient's gum tissue is stitched closed and they're given time to heal. Over time, the body will naturally integrate the new bone material with the existing bone, making the jawbone stronger and able to support the dental implant. Bone grafts start at around $500 in the US and $400 in Costa Rica. A sinus lift procedure is done when a person's upper jawbone isn't strong enough to hold a dental implant. When the molars of the upper arch are missing, the sinuses can expand and weaken the bone substantially. During this procedure, a small cut is made in the gum tissue to expose the jawbone. Then a small hole is drilled into the bone, and the tissue that lines the sinus cavity is lifted up. This creates space for bone material to be added. Once the bone material is added, the tissue is stitched closed and given time to heal, or in some cases the implant can be placed at the same time. A sinus lift starts at around $2,000 in the United States and at around $700 in Costa Rica. For reference, with travel and lodging, a general rule of thumb is that for somebody looking down the barrel of a $6,000 dental bill in the United States, that's about the point where with travel and lodging it starts to make sense to consider going abroad. Most of our patients are looking at bills in the $20,000 or more range. It's not uncommon for full mouth restorations to cost $40,000, $50,000, $60,000, even $70,000 in the United States. Please keep in mind, these prices vary depending on where you are. The US is a large market, and even if you choose not to go abroad for your care, you can save a lot of money by comparing the cost where you are with maybe smaller cities or lower cost of living areas. Just that change with just looking maybe outside of your state or outside of your metropolitan area, you could potentially save a large amount of money as well. And I encourage you to do that. In order to determine whether or not you're even a candidate for dental implants, you'll need to fill out a medical history questionnaire and get an assessment from a dentist. The majority of people are generally going to be candidates for dental implants, but uncontrolled diabetes, osteoporosis, and specifically taking medications like alendronates or biphosphonates, and heavy smoking are contraindications for dental implant cases. Don't take my word for it though, speak with a dentist, fill out the questionnaire, and see whether or not you qualify. Okay, let's talk about the logistics of a trip. Dental implants typically take 2 visits, 4 to 6 months apart. In the first visit, it's the actual surgical phase, and you'll leave with a temporary prosthetic made of a material like PMMA. It's like a plastic. And in the second phase, you're gonna get your final prosthetic. In our case, a final zirconia prosthetic. We recommend our patients stay for 10 days for this procedure because it's a complex manufacturing process and we want your final teeth to be perfect. We operate in San Jose, Costa Rica, and our patients fly into the Juan Santa Maria International Airport, the airport code SJO. There are direct flights to San Jose from across the US, Canada, and even Europe. And I found that the easiest way to get a great deal is to go on Google Flights. There are flexible ways to filter and determine when is the best time to travel at the lowest price. When you arrive in San Jose, you're going to deplane and go through customs. Once you're through customs with all of your luggage, there will be rental car agencies, money exchanges, and taxis waiting for you. With Apollo, we're going to send a driver to pick you up at the airport so you can sort of avoid all of that bustle and craziness. I highly recommend you do not exchange your money at the airport. You're not going to get very good rates, and honestly, just recommend waiting, using an ATM either in your hotel or out in town. If you're choosing not to get picked up by a driver, or if you're using a different company, God forbid, I recommend, rather than taking one of the airport cabs, I recommend calling an Uber, going onto the upper deck, going to town. You're going to save 50% on your taxi fare right there. In the first phase, you'll arrive in Costa Rica and shortly thereafter come into the clinic for a CT scan. This allows the doctor to make an assessment based off of a 3D image of your jawbone. Between this and an initial in-office visit, the dentist can finalize your treatment plan. Then you'll need to fast for at least 8 hours prior to IV sedation with the anesthesiologist. A quick note on this, it is possible to get dental implants placed under local anesthesia, but I would say about 80% of our patients choose to get it done under IV sedation. I don't blame them, but I do want to reiterate that it is optional. Depending on when your surgery is, you may get your temporaries placed the same day or at the very latest the following day. You will be prescribed 3 different medications when you come out of surgery, and that's going to be a non-opioid pain medication, an anti-inflammatory, and an antibiotic. We also have a little goodie bag that includes a powerful mouthwash called Chloroxyl and ice packs. Following the surgery, you'll have gauze in your mouth and you'll be instructed to bite down gently for about 30 to 45 minutes. This will help to control bleeding and promote clot formation at the surgical sites. You'll be able to apply ice packs to your face for 10 minutes at a time with a 20-minute break in between to help reduce swelling. We supply our patients with the ice packs as part of this goodie bag, like I said. You need to avoid hot or spicy food as well as hard or crunchy foods, especially in the first few days after surgery. Instead, stick to soft and easy to chew foods. I recommend yogurt, smoothies, soup, mashed potatoes, oatmeal, and avocado. Don't drink through a straw for the first few days after surgery, as the suction can dislodge any blood clotting and delay healing. This can cause dry sockets that expose the bone and nerve endings in the tooth and can be very painful. I say again, don't use a straw. Keep your head elevated while lying down to help reduce swelling. Brush your teeth gently, avoiding the surgical area, and use a saltwater rinse or mouthwash to keep the area clean. Take your medications as prescribed and take all of them. Avoid smoking or using tobacco products for at least a week after surgery, as this can delay healing. And ideally, use this surgery as an opportunity to leave smoking behind you. Follow your dentist's instructions for follow-up appointments and report any signs of complications. That could be increased swelling or pain. Just have an open dialogue with your dentist on those things. And then be patient and give your implants time to heal properly. Following these instructions and any others that the dentist may give you will ensure a successful and speedy recovery. So once you've left with your temporary teeth, you're going to have to wait 4 to 6 months for your implants to heal and fuse with the jawbone in a process called osseointegration. When you come back to Costa Rica 4 to 6 months later, you'll be fitted with your final zirconia prosthetics. This time, you'll need to be in Costa Rica for 10 days, which may surprise you because the first visit, which was surgical, took only 7. And the reason for this is because behind the scenes, there's a complex manufacturing process going on. You're going to get into the clinic, take another CT scan, and your dentist is going to assess how well your healing process has gone, whether your implants are integrated, and everything is ready to proceed. They'll also ask you some questions about your temporary prosthetic, and they'll use your answers to that in the design of your final prosthetics. In the lab, the team will digitally design your new teeth and send them to fabrication to be machined. This digital design and manufacturing process is called CAD/CAM, or computer-aided design, computer-aided manufacturing. Once the zirconia block has been milled, it will be sinterized. which is a fancy way of saying that we will cook it under high heat for around 12 hours. From there, the prosthetic will be sent to the lab for finishing, where it will be trimmed, polished, inspected, and painted to match a color that you've selected. Once it is painted, the prosthetic will be cooked again and it will be prepped to place in your mouth. The whole process, this whole fabrication process, takes about 3 days, assuming nothing goes wrong. Breaks, cracks, all of those things can happen and they need to start over again. That's why we tell you to come for 10 days. Then the prosthetic is carefully placed in your mouth. Hopefully everything fits like a glove first try. However, you may have some high spots, discomfort, or just general wonkiness. If it's minor, the prosthetic itself can be adjusted. Otherwise, it may be necessary to start from scratch. Thankfully, that's pretty rare, but it is a possibility. Once you have your prosthetic, things may feel great at first, but then you may realize the problem later. No worries, small adjustments can be made after the fact. Now it's finished. The journey's over. You've got the smile of your dreams again. You can smile confidently again. You can eat all the foods you've been missing out on, and you'll quickly adjust to speaking with your new teeth. Mission accomplished. For most patients, that is the end of the story. But in the spirit of providing a truly complete guide, here are some problems that may happen along the way and some solutions. We're going to start with some of the most serious concerns first, in this case, infections. And here, an ounce of prevention is worth a pound of cure. To prevent an infection, be sure to follow your recovery instructions. Take your medications as prescribed and until they are gone. Maintain good oral hygiene. You may even consider investing in a water flosser, which can clean around bridges and dental implants more easily than simply using a brush and dental floss. Infections happen. Your dentist may recommend something over the counter, ship you something. There's different options. Avoid tobacco products and vaping follow surgery, as both can really affect the healing process, particularly in the early stages of recovery. Implant failures. Dental implants have a very high success rate, but sometimes they do not properly integrate with the bone. It is important to speak with your dentist as soon as possible and return to Costa Rica to address the problem. If it isn't possible to make the return trip, you'll need to speak with the dentist at home. Temporary crowns or dentures can fall off of the teeth or implants that support them. If a temporary crown or denture falls off, take the following steps. First, keep the crown or denture safe. Try to locate the crown or denture and keep it in a safe place where it won't get damaged or lost. Clean the area. Clean the area around the tooth or teeth where the crown or denture was placed. This will help remove any debris, food particles that may be trapped in the area. Reach out to your dentist. Get their opinion. Follow their instructions. And don't delay this, because the longer you wait, the higher the risk of further damage. Avoid eating hard or sticky foods. By avoiding hard or sticky foods, you reduce the chance of this happening in the first place. And then, as a temporary solution, use a temporary dental adhesive like Fixodent. Some patients may have pain following the procedure. The pain can be caused by a variety of factors, including swelling, inflammation, infection, nerve damage, or an issue with the implant itself. It's important to speak with your dentist or oral surgeon. They may recommend pain medication or icing, or they may ask you to return to the clinic. Overall, in the dozens of people that I've helped get dental implants here in Costa Rica, the vast majority come down, they save 50 to 70%, they go home with a new smile, refreshed, happy, ready to rock. Thanks for sticking around to the end of this video. I wish you the very best of luck on your journey to get dental implants here in Costa Rica. If you'd like to reach out to me about any questions you may have, or if you'd like to be one of our patients, you can find us at apolomedicaltravel.com, or you can give me a call at 888-382-4929. Safe travels, and I look forward to seeing your smile.